Each year, 50,000 Americans find out they have melanoma. Is a vaccine for this deadly skin cancer around the corner? We went to Hoag Memorial Hospital Presbyterian in Newport Beach and spoke with Dr. Senthamil Selvan about the research that's underway to fight this disease.
Hoag Cancer Center is focused on melanoma. Why? The reason is, if you look at the recent National Cancer Institute's SEER data, they estimated around more than 60,000 new cases of invasive cutaneous melanoma is going to occur, and out of which more than 8,000 people are going to die of that disease. Patient-specific vaccine implies particular therapy product is made specific to one particular individual. And why we do that is, as in cancer, it's not a single disease, it's a heterogeneous population of cells. Like human beings, we are all similar, yet we are all unique. And the disease also, like cancer also, similar but unique in its own way. Even within the given body, each tumor is different in a given site too. Like for example, the tumor tissues occurred on the skin has a different biology than the tumor is spread to the lymph node, for example, spread to the armpit. That is different. And that is the reason to attack the heterogeneity of the cancer cells, we have to make it tailor-made. It's a individualized so-called therapy. That's we call it as a patient-specific vaccine. Hoag sets a different approach in this patient-specific vaccine. Other institutions use freshly harvested, that is surgically removed tumor tissue to make a vaccine. What we do is, we take the tumor tissue, surgically resected tumor tissue, we culture them, make it as a pure tumor cell line. The reason being, when you take the fresh tumor, it is not only composed of only cancer cells, it also has other contaminating, we call it as contaminating, normal cells, like fibroblasts, for example, or lymphocytes. It's a mixture. That is why if you want to make a vaccine to work better, we need to have a purified tumor cell line. Once we establish a pure tumor cell line with, for example, 200 million cells, for example, what we do is we irradiate them, so that we need to arrest the growth of cells so that when you give it to the patient, it does not grow. There is a patient, 56-year-old patient. He had a stage 4 invasive metastatic melanoma. Before coming into our vaccine therapy, he had several recurrences, including distant recurrences, including liver, bowel, and then lung. After getting rid of the tumor, surgical resection, and also he went through other treatment, he came on board with our vaccine approach. And that particular patient is disease-free for 5 years now. And then there is no recurrence at all. It takes me medium time, 4 months to make a vaccine. But we do allow the patient go on to other trials before they can onboard with our vaccine approach. It does take time. That is one of the challenges I'm taking as a scientist, to make sure whether can we make the product much quicker than 4 months. This is a ongoing research which we are actively involved in.